Hey guys, Curtis Alexander. I'm a pharmacist. In this video, let's talk about using Ginkgo Biloba. Can it help with memory, dementia, Alzheimer's, those sorts of things? So first and foremost, we have to understand, we have to kind of set the stage for what we're talking about as far as a diagnosis and how far along people are in this stage of, are they experiencing temporary, kind of transient memory loss? Has it developed into dementia? Are we looking at Alzheimer's? There's kind of this continuum, and that will help determine if Ginkgo is going to be helpful for your situation. So first, let's look at some studies. What we normally are finding is that if you give 240 milligrams of the Ginkgo per day, we do see a modest improvement, and they did this in Alzheimer's and dementia patients. They did see a modest improvement in their cognition and their activities of daily living. So they were functioning better compared to not having it or compared to the placebo. Now, they did drop the dose to 120 milligrams a day and tried to look to see if there was any benefit there. There was not. So it appears that 240 milligrams is kind of that dose that we need to be shooting for if you're going to take Ginkgo. Something to keep in mind if you're in this dementia or somebody is in this dementia or Alzheimer's state, sometimes they can have psychosis, psychotic symptoms. It does not help with that. It does help with the cognition and the daily living stuff, but not psychosis. And then there was a study that looked head-to-head comparing Ginkgo versus some of our cholinesterase inhibitors, which are things like Aricept or donepezil. How does it compare to those? And it actually compared pretty favorably. They took, again, mild to moderate patients with Alzheimer's disease. Again, they gave them the 240 milligrams a day. They did this for 22 to 24 weeks, and they found that it was roughly equivalent to 5 to 10 milligrams a day of Aricept or donepezil, which is promising. They also bumped the dose up to 150 milligrams 3 times a day for 6 months. Also found it was roughly equivalent to donepezil 5 milligrams a day as far as improvement in the patient's cognition scores, okay? Now, interestingly enough, I get questions on, well, can I combine Ginkgo with somebody's donepezil? Will that help improve the cognition scores, improve the effectiveness of the donepezil? We haven't seen that. It does not appear to be the case, so adding it on doesn't appear to help that much. Also, the question is, well, can I just take Ginkgo to prevent memory loss in the future, or to prevent Alzheimer's? We don't have good evidence that that works either. It tends to be a situation where somebody is beginning to experience memory loss or has dementia, in some cases Alzheimer's disease. We can see those cognition scores improve. But as far as preventing those in the future, we don't have any evidence that that works. Okay, so now as far as the products, if you do want to do this, again, we want to shoot for that 240 milligrams a day at a minimum. I wouldn't go below that. And you want to focus on products that contain 24 to 25% of flavone glycosides and also 6% terpenes, lactones. A lot of big words. I'll include links to the products that meet those requirements in the description if you're interested in looking at those. Let me know in the comments, please, if you've tried this. Did it help? Did you notice any improvements? I really value your feedback, and so do other people that watch the video. Speaking of value, I hope this video was valuable. I will see you in the next one. Thank you.